What are we talking about tonight? We're talking about healthcare reform, patients before profits. Tonight, Mr. Speaker, I think this presentation could not be possibly more different. It could not possibly be more different from the hour that you just heard, because the hour that you just heard a moment ago talked about what we couldn't do, who couldn't get care, why we have to have the status quo, why things have to be the way that they are, why we cannot have reform. That's what you just heard an hour ago. Horror stories and horror stories, fear-mongering like we've been hearing for many decades now. We heard the same thing in 1994. Remember Harry and Louise ads? Oh, the government's going to take your health care away. Oh, the government's going to make medical decisions for you. Well, let me just say that it's not true. Don't fear. The American people should not fear health care reform. The American people, 300 million strong, know that 50 million, nearly 50 million of our number are without any health care at all. The 250 million who do have health care know that the private insurance companies have been reaping enormous profits while you've been paying higher deductibles, you've been paying higher copay, and you've been paying higher premiums, and you've been being denied coverage for pre-existing conditions. The fact is that the time for change is now. And I think for the first time in a long time, real change is right within our hands. Mr. Speaker, if the American people have a will for a greater level of health care, for a greater level of quality of life, in which all Americans don't have to go to bed at night afraid that they're going to be without, this is the time for them to raise their voices. I think a few things are important to know. A few things are important to know, Mr. Speaker, and that is that just like in 1994, the scare tactics that we just heard and that we'll probably hear again tonight are in full force. And if the American people don't step forward, Mr. Speaker, you don't know which vision of our America is going to prevail. A progressive vision for health care where all Americans have health care, where all Americans have access to care that says prevention, that says long-term care, that says that we're going to have a public option, which we desperately need, or this situation which leaves 50 million Americans out and escalating costs and pre-existing conditions, which doom people to a medical nightmare. We'll talk more about that in a moment. But I just want to say that the fight is on, it's raging, it's happening, and if the people want to be heard, Mr. Speaker, they need to be heard now. Let me just say this. In the first 3 months of 2009, the Chamber of Commerce and the Pharmaceutical Researchers and Manufacturers of America, PhRMA, paid lobbyists a combined $22.5 million to promote their interests. Okay, you didn't hear me. $22.5 million to lobby people like me, Mr. Speaker, to not give the American people health care, to keep the status quo, to let it be how it is, to let these pre-existing condition exclusions continue on, to let 50 million Americans out in the cold, to continue the increasing premiums and these ridiculous co-pays people are having to pay. You didn't hear me? The first 3 months of 2009, the U.S. Chamber of Commerce and the Pharmaceutical Researchers and Manufacturers of America, PhRMA, paid lobbyists a combined $22.5 million to promote their interests. $22.5 million in January, February, and March. You think that's a lot of money, Mr. Speaker? It's nothing if you compare it to the amount of money they made by denying Americans health care. By denying enrolled Americans health care as the way they've been doing and saying, oh, we don't cover that, we don't cover that. And by reaping all these excessive profits, oh, $22 million is a rounding error for them. But it's an enormous amount of money for us, Mr. Speaker. Monday, July 6th, just a few days ago, the Washington Post said, familiar players in healthcare bill lobbying. The largest insurers, hospitals, and medical groups have hired more than 350 former government staff members and retired members of Congress in hopes of influencing their old bosses and colleagues. That's nearly one, and that's not quite one for every member of Congress, but it's almost nearly one from every member of Congress, and that's just counting the former members of Congress and former staffers, just to try to twist an arm to say leave the status quo as it is. 3 out of every 4 major healthcare firms have at least one former insider on their lobbying payrolls, according to Washington Post analysis. Nearly half of the insiders previously worked for key committees and lawmakers currently debating whether to adopt a public insurance option, which is opposed by major industry. So they're going getting people who used to work here to come try to stop progress and keep us from a progressive vision, because they care about what? They care more about what? They care about profits before patients. And what we in the Progressive Caucus care about patients before profits. The hirings are part of a record-breaking influence campaign by the healthcare industry. Now you say, I say record-breaking. This is according to the Washington Post, Mr. Speaker. Record-breaking influence peddling campaign by the healthcare industry. And you know, Mr. Speaker, you may have been dazzled, shocked, and amazed by what you saw in 1994 when they, in fact, killed healthcare. Now they're pulling out all the stops, and they're going to make sure they set a record in the amount of influence that they're trying to campaign for to defeat healthcare reform. They want the status quo. We want a progressive vision. They're spending, Mr. Speaker, just hold on to something, because this number might stagger you. $1.4 million a day. $1.4 million a day. Nearly $1.5 million a day to stop healthcare reform by paying lobbyists, and this is just according to what's been disclosed in their records. $1.4 million a day just to lobby against healthcare reform? Yes. So, Mr. Speaker, if the American people want healthcare reform, they better say something, because 1.4 million a day can speak pretty loud. The Pharmaceutical Research and Manufacturers of America doubled its spending, nearly $7 million in the first quarter of 2009, followed by Pfizer with more than $6 million. If they're right, if this system is good, why they spend all this money? Can't they just let the facts speak for themselves? No, the facts need to be adjusted for them. The Post examined federally required disclosure reports submitted by healthcare firms that spent more than $100,000 lobbying in the first quarter of this year, and it used current and past filings to identify former lawmakers, congressional staff, and executive branch officials. This is a quote. "Revolving door offers a shortcut to a member of Congress to the highest bidder," said Sheila Krumholtz, who's the executive director of the Center for Responsive Politics, which compiles some of the data used in the Post's analysis. It's a small, here's her quote, and this is really a shocker, Mr. Speaker. "It's a small cost of doing business relative to the profits that they garner." So again, 1.4 million a day in many other cities across America who have recently been laid off because it is a guaranteed affordable option that can travel with an individual from job to job. Public health insurance option would also make a tremendous difference in our small business owners who are facing crippling health care costs while trying to keep their businesses open. That is the great Senator Russ Feingold, as he spoke passionately and convincingly about a public option. I just want the American people to know, Mr. Speaker, that in the House of Representatives and in the Senate, there are leaders who have heard the cries of the American people, who have heard the demands for change, and who are going to stand up for a public option. And I think, Mr. Speaker, that I just want to take a second to say thank you to all those members in the House, but also these 3 senators and many others, Feingold, Sanders, and Schumer, who have gone on record for a public option.